Well, welcome back to Fox 10 News at 4. We have Cassandra Greganis here with Children's and Women's Hospital to talk more about the importance of prostate cancer screening and also the genetic aspect to that. Cassandra, thank you so much for stopping by.
Thank you so much for having me today. I really appreciate the opportunity to be here.
So we know the importance when it comes to screenings. Remind us again about the tests that we can get for that.
Yeah, so as far as prostate cancer screening, all men at age 50 are then eligible for prostate cancer screening. That is typically done with a blood test that's called a PSA, or prostate specific antigen level. And it's a really simple test that your doctor can run typically every year to screen for prostate cancer.
And the age for that has recently gone down. I believe it's now recommended for men in their 40s?
Yeah, so it can be recommended for men starting typically at age 45. If you say have a family history of prostate cancer, or say other suspicious findings like on the prostate exam, which is the digital rectal exam.
And that leads us right into the genetic aspect of this. It always comes back to genetics.
It does. And so a lot of people can be really surprised that prostate cancer does have genetic factors or can be caused by this single genetic cause. And so I really want to bring awareness to the fact that yes, men, it can be genetic. And so I want you to be looking out for those genetic risk factors. And that's things like cancer at an early age, or metastatic prostate cancer, multiple family members, brothers, fathers, grandsons, things like that with prostate cancer. And also in the family, other cancers. If you've got prostate cancer and then you have a family history of mother with breast cancer, sister with ovarian, I want you to be aware of that and let your doctor know. Let them know that you have that family history, and then they can say if genetic counseling and genetic testing for these genetic causes for prostate cancer and other cancers could be right for you.
So you got to have those conversations, and it's not just for your health, but potentially for your child.
Right, exactly. Your children, your grandchildren, brothers, sisters, and even parents, grandparents. It can go back or forward.
Well, we're almost out of time, so before we go, anything else you want to add?
I just really want to add, again, men, you can get cancer, prostate cancer. Also, men can get breast cancer, colon, these other cancers. So I just want to stress, with Father's Day here this past weekend, that you be having those conversations with family members and talking about that with your doctors as well.
Well, thank you so much, Cassandra, for stopping by.
Thank you.
And we'll be sure to get this interview posted for you on our YouTube page shortly after this newscast, so be sure to subscribe. That way you'll be notified when we post a new video there. Thank you again.
Thank you.